The clinicians have to play a very strong role as far as being the voice for those people that we represent, being the patient advocate, if you will, to articulate to Congress and to the rest of the nation some of the challenges that we have. In developing that workforce, though, we need a committed cadre of professional folks that can carry out what we like to refer as a team approach. It's not just a model where there's a physician at the top of a pyramid. We tend to work in we call a community-oriented primary care team approach, where you have multiple levels of providers, be it the physician along with the nurse practitioner, physician assistant, providing that total care. The concept of a patient-centered medical home is something that we have pioneered through the 40-year history of the community health center movement. And it's those folks that are involved on that level that can really speak to the issue of comprehensive primary and preventive care. We're not talking about just medical care. We're talking about oral care with the dental staff and hygienists and folks involved on that level. The mid-levels, the nurse practitioners, the physician assistants, mental health, all the issues that we deal with that go into making us unique in being a solution, a part of the solution to this problem of access. I think the whole initiative itself, the Access for All America, is a very bold and, as we like to say, bodacious plan. The reason that it is such is because the need is so great. Right now we have over 56 million disenfranchised people in this country who lack primary care medical home. They don't have a primary care provider or clinician that they can call their own. So the need is great, and to solve the problem, we are doing this in a very thought out way. We recognize that we need some capital because we have built it and they have come. As a matter of fact, most of us are operating right now at full capacity, so much so that we physically can't take on any more. So it's absolutely critical that we build the facilities that can house the team that I mentioned earlier that can help to address these healthcare issues. It's not enough that we did 40 years ago where we started occupying houses and churches and buildings that were not set up to be medical or healthcare homes. We need the physical space to allow for that growth to accommodate these 56 million disenfranchised people. Our bold initiative calls for us to serve 30 million people by 2015. And that's a daunting task, but I have no doubt in my mind, through the clinical leadership and those of us on the front lines, that we can meet this challenge. We can articulate those areas that only we can talk to. The stories that we hear, the patients that we deal with on a day-to-day basis are counting on us to be their voice, to make this bold plan a reality. And as I said, there's no question in my mind that we can achieve this. Look at the landscape as it is right now. We recognize that to accomplish what we're trying to do with this Access for All America is going to take an additional 10,000 providers by the year 2015. Now, recognizing that, we have several strategies that we have in place to try to address that issue. One, of course, is using the National Service Corps, which I can personally attest to because that's how I arrived at the health center that I'm currently have been at for the last 25 years. I was a scholarship recipient, and that was tremendously important. Students coming out today are, on average, have a debt load of almost $200,000 to $250,000. So the scholarship program is one that we certainly are emphasizing and looking to increase the number of participants in that venue. In addition to that, the National Service Corps and the loan repayment program is also a critical component that we will use to try to increase the workforce. And that is applied to, as you know, not only physicians, but to nurse practitioners, PAs, dentists, as well as those people that work in the team approach that we talked about. Working with medical schools to redirect students into primary care is also a critical area. We've made partnerships with the AAMC, the AAFP, and several other organizations to try to influence students' behavior, to let them really know that you can have a very rewarding, gratifying career in primary care, particularly in the community health center venue, where you don't have to be concerned with the overhead per se, and you can really put patient care at the forefront of what the reasons why you went into medicine and dentistry and the things that you really want to do, addressing people's needs not without regard to their ability to pay, working with them to empower them with the tools that they need. We're calling out to those type of clinicians who have that sense of service, if you will, that calling to the real inner aspect of why we all went into healthcare careers. It is a calling. I've often told my students that. I mean, many are called and few are chosen, and it's a tremendous privilege for us to carry out the work that we've been called to do. We've often said and we recognize that we are not the panacea, but we are a great part of the solution. Now, recognizing that, it's going to be critical that we have partnerships with the private sector, as well as all those people that are involved in trying to solve this healthcare dilemma that we find ourselves in. That's going to be reaching out to the medical institutions, the private sector, the AHECs, the trade or associations that many of our clinicians already belong to. It's working together with the patient being in the center of this equation that we are going to solve this problem. But those alliances, those networks, the ability to have people that we have to refer to. When you're doing primary comprehensive preventive care, there will come a time when obviously you have to refer those folks off to people that are subspecialists in specialty care. And it's critical that we have those linkages and partnerships in place. If you look at historically, I think the roles that we've played in the communities that we represent, we've done a very good job, and all the data proves that we've had really great clinical outcomes in prevention and primary care. I think it's critical that we continue that relationship and build upon that, as this hopefully 30 million more people can come into the healthcare system and hopefully choose us as their medical homes. I guess the takeaway message on of all of this is that we're really at the threshold right now of having a tremendous sea change, if you will, for this country. We recognize that landscape, there's 56 million disenfranchised people out there, many of whom who have insurance coverage, if you will, but do not have access to care, or longing and I think deserving, more importantly, of having a healthcare home and a primary care provider that they can call their own. I know from experience that we have the talent and the quality of people in our organizations and in our movement to provide that sort of care. So now is not the time for us to sit on the sidelines and to watch this parade pass by. I think it was Teddy Roosevelt who said, the man that dared. Well, I'm issuing a challenge out there to all of you to get involved and be the advocates for your patients.